Got a bunch of great questions to answer today, so let's get started. Welcome to Office Hours. I'm Dr. Meghan. I am a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications. I actually talk to patients about their weight. I've helped hundreds of patients lose weight, and I'm here to help you too. As a side note, if you have questions after the video, please leave them down below. I'm always happy to answer your questions, and if I can't get to them for the next one, I'll just add them on the list and I will get to it as soon as possible. Let's see, what else to go over? Oh, if your question leans a little bit personal, I'm going to alter it slightly to make it more educationally applicable. I can't answer personal medical questions because I'm not your personal doctor, so I might alter it a little bit. What else? If you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to weight questions, you are in the right place. So we are going to jump right into it. As a side note, if you want to work with me directly, I will leave that info at the end. Okay, questions. I don't know if I already asked. Okay, have you seen a side effect of increased mucus? Generally after shot day. Okay, this person is on a GLP-1. In terms of increased mucus, that is not something that I've heard patients complain about a lot. And it's definitely not really a common side effect, especially with tirzepatide. It is a possible but less common side effect in terms of semaglutide. So semaglutide meaning Wegovy or Ozempic. I don't hear about it a lot, but it's within the realm of possibility. And certainly we could imagine that it was well within the realm of possibility for tirzepatide and liraglutide as well. Of course, as we've discussed before, people are not textbooks and they are not manuals for medication. So is it possible that you are having side effects for this medication that are not listed on the, most well-known side effects? Absolutely. So I would love to know if anybody else has noticed if they're having like increased mucus or what we call like nasopharyngitis, like cold-like symptoms. Would definitely love to hear about it. Thank you for asking such a great question. Do you notice if people get stuck at the same weight for 6 weeks? Okay. For example, potentially on Mounjaro went up to 12.5. Okay. Yes. So it's definitely, okay. So the question is, do people get stuck at the same weight for several weeks at a time? And yes, this is not totally uncommon. I think it's just, for a lot of people, it's part of their weight loss trajectory. So some people find that they lose weight, then, they're on a medium dose and nothing goes anywhere. So, and then they start the next dose and it goes right down. So, yes, that's not terribly outside the realm of possibility. And I would just check in with your doctor, make sure nothing else is going on. Also, see if anything else has changed. If this has happened to you, and also, always, sometimes this might happen if somebody's appetite has returned and it was really severely depressed in the beginning. They may notice that the weight loss trajectory is not as, rapid as it was. These are all pretty, known variables. So I wouldn't, if I had a patient who was losing weight and then it kind of plateaued on one of the medium doses, I would not get too worried about it. I would just continue on. As long as they're not having significant side effects or anything that's really interfering, complication-wise with what's going on for them, I would just continue to move along the prescribing pathway and see what happens. So I don't think it's a reason to get too upset. I would just continue to watch it. If somebody, people who have type 2 diabetes, they may notice that their weight loss isn't as profound as somebody who doesn't have diabetes. That can certainly happen. But overall, I think, for anybody that this has happened to, I would just continue on the prescribing regimen and keep an eye on it. Definitely check in with your prescribing physician, but definitely not a reason to panic. Thank you for that question. Okay, this is more a question than a comment, but I thought it was a good one to go into. 2 weeks into using Retatrutide from Swisschems instead of semaglutide. Noticed a significant improvement in my appetite control. I wanted to touch on this because Retatrutide is actually not FDA approved yet. And Retatrutide is under development currently, but it's not FDA approved. So this is not a medication that is currently commercially available. So I would be worried. This does not seem like a safe plan. This is, for anybody who's taking anything called Retatrutide, this is just a general public service announcement. This is not commercially available. This is not FDA approved. Eli Lilly is developing Retatrutide, and they do not sell the active ingredient to compounding pharmacies anywhere else. So we don't really know if somebody, is taking Retatrutide. We really don't know what they're taking. And even if it was Retatrutide, it's not coming from Eli Lilly, so we're not really sure exactly what it is. So I would, anybody who's taking something like this, I would strongly encourage them to look at other FDA approved, commercially available, safer alternatives, just for your own personal safety and for, to make sure you're getting a product that works. So that is the PSA for today, but thank you for sharing that, because things are out there and who knows what they are. Okay. Is there such a thing as withdrawal from Zepbound? Not really. And of course, everybody is different, but if someone has been on Zepbound for a month or 2 or 3, and then they have to go off, there's not really a withdrawal. I mean, it stays in your system for quite a while. It has a pretty long half-life. But what people do notice, because with the shortages, people find that there are periods of time where the distance between injections is longer than they would like. And sometimes they miss the medication for a month or 2. That's a real problem for a lot of people. And a lot of times what people notice is I can just feel it's not working anymore. So not a withdrawal, like their body is craving it, but, or having an adverse reaction to it not being there, but more just this slow return of symptoms that they were very delighted to see not be there. So their appetite is coming back, and is a stronger appetite than they feel like is healthy for their body. They have more food cravings. They're thinking about food more. All those they really feel like they have returned and noticed they were suppressed before, but now they're slowly coming back. That can definitely happen for people. So if you notice that, that's definitely not uncommon. Okay, that's going to do it for today. Thank you all so much for your questions. If you have a question after this, you can definitely add it to the comment section or on any of the videos. I love your questions, and they're always so smart and so thoughtful. So thank you so much for sending them in. If you want to work with me directly, I am working with people one-on-one as a life coach. We're working on fixing the next big thing that's coming between them and their weight loss. So if you're interested, definitely you can click on the link down below to schedule a consult. Be delighted to talk with you. But yeah, that's going to do it for today. Thank you so much for watching. And as always, please be well.